I would like to ask your permission to use this video for educational purpose and on internet. So tell me about the surgery that you and I did.
We had surgery in Riverview in Crookston, Minnesota in July, and I had the surgery. It was very successful, but when I came out, I was in a severe amount of pain.
Mm-hmm.
I mean, I was crying, and I kept asking for more medicine, and they said they can't give me more. And I was aggravated, I was upset, and
Rightfully.
yeah, because I thought I'd be more comfortable after having that surgery.
Yes. Now in that surgery, I'm going to turn around. We put a lots of metal inside of you. Here, there's lots of metal. There's really no way after 3-level fusion, you cannot feel that. So, and I tell everybody, now first day is rough. We just have to get over it. But we start the pain medication at certain level. And then once I review everything, if I feel that too much more medication would be dangerous, sometimes it's actually a fight between me and the nurses, because the nurses just want you to be comfortable, but I want you to be safe. And so the first day, that was right after the surgery.
Yes.
So how long did it take for that to get better?
The second or third day, my body was getting used to the pain.
Yes.
I mean,
so it took a few days
yes,
for that to get better. How long did you stay in the hospital?
I believe I was in the hospital for 2 or 3 days.
2 or 3 days, okay. So no, it was painful with that much metal and so on.
Extremely.
Yeah, but it got, after a few days, it got better. But you told me about another episode with somebody else. Tell me, what happened there?
I was back in Illinois. I had back surgery with another doctor, and I was in a lot of pain, just like I was telling
After
you,
my surgery, yeah.
After your surgery. And I asked the nurse, I said, can you give me something stronger, just a little bit extra? And I thought she killed me. My tongue was hanging out. I couldn't stay awake. I kept falling asleep. I thought I was going to fall asleep and die, basically. They tried to send me down for an MRI. I couldn't even get out of the wheelchair. And I had all the nurses. There was about 7 nurses around my bed. They asked me, do I know my name?
So you almost needed to be resuscitated.
I was very close.
Yeah, very close.
And
yeah.
that was because I wanted to feel comfortable.
Yes. Now I hope you are, even though I know at the moment you were angry with me that I didn't want to give you more medication, I hope now you understand that what it means, safety before comfort. Safety before comfort means that sometimes we make people so comfortable that they quit breathing.
And that's the issue. I mean, where do you draw the line at? And
It's a very
people don't understand that. I do, because I seen both sides. I seen when I was in a terrible amount of pain for a couple days, and then I seen it where I was hoping to God that medicine would just get out of my system.
Yeah.
Because every time I closed my eyes, I thought I was going to die.
Yeah. Well, and I really hate to say that in the United States, right now, people are dying because of overmedication in the hospitals. Still do. And I just not long ago had a patient like that, actually, and that just got overmedicated because some other doctors thought that more medication is appropriate to make the patient comfortable, but that exactly put the patient over the edge. So you see, and you have both experiences.
I do.
So you understand why I was hard there, and then didn't stomp my feet and said no more, because more exactly does what it did in the previous surgery.
I mean, you get so mad at your doctor,
Yeah.
because you think he could just write a script or just, give you a shot and take care of everything.
And sometimes as well, nurses get upset and report us. They say he doesn't give more medication to the patient, but then when some doctors who are less experienced, they literally give up, and they do, and then you have a situation that literally patient die of overmedication. That happens still.
And nobody wants that to happen.
No, nobody wants that to happen, and the nurses have good intention, but on one side, they want the patient comfortable. Right. On the other side, they don't consider that the downside of that is that we have a comfortably dead patient.
Yeah.
So, well, thank you. Is it possible that if I ask you share this experience with other people and so on?
Yeah, that's fine.
Yeah, I would appreciate that. Thank you very much.
You're welcome.
Thank you.